Hello, I'm Dr. Shivakumar, Pain Management Specialist at Akkineni Hospital. Hope you are doing well. We'll go through some important points today. Please stay engaged and note them.
Welcome to This Explainer. Okay, today we are tackling a heavy and frankly exhausting topic, the burden of chronic joint pain. Whether you're dealing with osteoarthritis, rheumatoid arthritis, or gout, we all know the constant stiffness and physical limitations can just seriously drain your quality of life. But what if there was an empowering, drug-free way to push back against that pain? So I want to ask you this crucial question right up front. Can applying simple, targeted pressure actually relieve chronic joint pain? Now, I know it sounds a little bit like magic, but today we are looking strictly at the biology, and the answer might completely reshape how you handle your daily discomfort. Here's our roadmap for today. We'll quickly cover the reality of arthritis pain, how acupressure relieves it, key points for joint relief, what the research actually says, and finally, your daily routine. Let's shift you from a passive patient to an active, empowered manager of your own pain.
Section 1. The reality of arthritis pain and the heavy burden it places on your daily life.
Look, we have to start by just validating the daily struggle. That constant ache, the morning stiffness, it's incredibly draining. And while pharmacology, like NSAIDs, is the standard cornerstone of treatment, it really doesn't have to be your only tool. A lot of people are actively searching for safe, complementary self-management tools. We're talking about adjuncts you can use right in your own living room to find relief.
Moving to Section 2. How acupressure relieves pain. Let's demystify this and ground it firmly in the biological mechanisms.
This is where it gets super interesting. Have you heard of the gate control theory of pain? Think of acupressure as literally closing a physical gate on your pain signals. When you apply sustained pressure, you activate these large diameter nerve fibers, and these large fibers basically sprint to your brain way faster than the smaller pain fibers, effectively blocking the pain signals from getting through. Honestly, it's the exact same biological reason you instinctively rub your knee right after you bump it. But wait, it goes way beyond just blocking that physical gate. You're also triggering a massive release of endorphins, your body's very own natural pain-suppressing compounds. On top of that, you're improving local circulation, which flushes out metabolic waste and brings fresh nutrients straight to the joint. It also relaxes those tight joint-stiffening muscle spasms. And crucially, it lowers cortisol, knocking down the stress that triggers pro-inflammatory responses in the first place. You are basically attacking the pain from multiple biological angles all at once.
All right, Section 3. Key points for joint relief. Let's map out exactly where this healing happens.
You might want to actually grab a screenshot of this one. It's essentially your personalized relief cheat sheet. If you've got knee issues, your targets are ST36, SP9, and GB34, located just below the kneecap and inner leg to bring down swelling. Dealing with hand and wrist arthritis or carpal tunnel, you're looking at LI4 in the thumb web, LI11 at the elbow, and PC7 at the wrist crease. And hip pain is just fascinating. You use GB30 in the glutes, but also BL40, which is right on the back of your knee. It perfectly alleviates that deep pain radiating down the leg. It goes to show how incredibly interconnected our neural pathways really are.
Just to compare how specialized these points are, take LI4 in the hand. It is absolutely fantastic for localized inflammation and upper extremity pain. But then drop down to ST36, located 4 finger widths below the kneecap. That point is a systemic powerhouse. It doesn't just target local pain, it actually stimulates immune regulation and reduces systemic inflammation throughout your entire body.
Which brings us to Section 4, what the research says. Let's look at the evidence-based relief. Now, you might be thinking, is this just theory? Well, the research backs this up beautifully. Systematic reviews show clinically meaningful reductions in pain and real improvements in physical function. That means actual, noticeable differences in how you move every day. The effect size is modest to moderate, which is actually a huge deal because that makes it completely comparable to traditional exercise therapy. So yes, this is a highly validated, evidence-based practice.
Okay, Section 5. Your daily acupressure routine. Let's turn this science into action and take back control.
Follow these 3 simple steps to create your own highly actionable home care protocol. Step 1. Always warm the joint area first to get that circulation going. Step 2. Apply firm, steady pressure to your specific target point. And Step 3. Hold it right there for 2 to 3 full minutes per point. Nice, slow, and deliberate. You can just use your thumb, or honestly, a blunt instrument works great too if your hands are feeling sore. Just make sure you hit bilateral points, meaning do both sides of the body, not just the side that's bothering you the most. Aim for twice daily. And remember, consistency is totally the key here, and you can absolutely bump up that frequency when you're in the middle of a tough arthritis flare. Now, as amazing as acupressure is for self-management, it's ultimately just one piece of a bigger puzzle. For folks looking for a totally comprehensive approach, integrated medicine departments, like the ones at Akkineni hospitals, blend acupressure, acupuncture, physiotherapy, and conventional medicine all together. It's the whole shebang for total holistic care.
So I'm going to leave you with this final thought. Arthritis is a heavy burden, for sure. But as we've seen today, you literally have biological tools right at your fingertips to help close the gate on that pain. Are you ready to take the pressure off your joints by putting the power of healing back into your own hands? Thanks for tuning into this explainer, and here's to healthier, happier joints.